All right, so going through quickly glute 1, 2 and 3. So remembering using that sidecar configuration for glute 1, glute 2, large balls in your bum, little ones towards your feet. So laying flat down on the ground, remembering the rules: position, placement, pressure, progression. So position yourself, lay flat on your back, feet up, lift the bum up, 2 large balls, sit high in the glutes. You can shift these lower as you go, but for starters, we'll start them high in the top. Placement, position, placement, pressure. Pressure, cross the left leg over the right, drop a little bit of body weight out to that side, and we're looking for the symptom. This is where we talk about nature and behavior. What does it feel like? How does it behave? So I want you to hunt an area that's tight or tender, rest on it until it becomes about half of what it started at, and then move on. Every time we're just micro moving, hunting fiber by fiber. Feel how it feels, feel how it behaves. If you feel your bum cheek coming off, just wedge the opposite hand in as such. That will act as a pressure delivery and give you a little bit more stability. From there, glute 2, we go from that top position, we float that leg down, and what you should feel is that will hit those deeper hip rotators, so the obturators and the gemelli and whatnot. Say hi to Coco. And again, position, placement, pressure, progression, nature and behavior. Feel how it feels, feel how it behaves. Now this is where you become to apply the perfect amount of pressure in the exact spot every time. Hey Pegsy, how are you? So this top leg, if you open that up, it'll deload the bum. You bring this one across, it will load it up. Same as before, feel how it feels, feel how it behaves. Rest on that, close your eyes, feel the response to your effort. It's all about being able to apply the perfect amount of pressure to the exact position every single time. All right, and remembering, if you feel that bum cheek come off as you work yourself around laterally, wedge that hand in, and that will just help with your delivery. From here, you can progress by including this little micro oscillation. That'll create like a transverse friction if you need more. Other than that, glute 1, glute 2, they're gonna be your lifesavers. Get to it, and I'll go through glute 3 very shortly. So glute 3, lateral hip, TFL, call it what you want. Here we use the favorite configuration of everybody. Basically, we can either use shaft, ball, we can come in, we'll position ourselves, laying on your side, heels bent up, knees are relaxed. We're looking for the top of the hip and a bony prominence there being your greater trochanter, and pretty much smack bang in the middle. So if we come in from the front, we can just lift up and slowly drop some body weight on. Again, open the knee up, we'll deload, bring the knee forward and the shoulders around, we'll load it up. So here we're just looking to change the angular pressure to be just millimeter perfect. This opposite hand, pop it under your head. So you're nice and relaxed. Feel how it feels, feel how it behaves. Don't forget you can come in from the back as well. So, boom, lifting up. Different angles will hit different areas in different directions, so just fiddle around with both of them. The beauty about body spanner as well is you can either be using shaft, ball, or if you want a little deeper penetration in that lateral hip, we just open that up and create that sort of 2 to 3 centimeter extension. That takes away the protection of the shaft, and then that will penetrate a little deeper in that lateral hip. From that position as well, feel free to hit the lateral quad. Super simple. Basically a line from that greater trochanter to the outside border of the knee. We start a couple of centimeters below that bony prominence here and a couple of centimeters above the lateral joint line, and we'll hit 4 or 5 spots. And this isn't pleasant, but is so good for the lateral quad. Oh. Once that eases away, we shift just a little higher or a little lower. If you want to intensify this, we can also create this longitudinal scrub or a little transverse friction. Ooh. Often not needed. Mind you, this will be really uncomfortable. However, it will free up. About 3 or 4 weeks down the track of doing this, you won't know how good your legs feel. Pretty amazing. Check out the other quad release as well. It's pretty sick. All right, until then, I'll show you a quick calf and another one for a knee opener, and we'll run from there. Cheers. So now we're going to go to one of my absolute favorites. Whenever you have trouble getting your heel to your bum, or you have trouble with knee flexion, or you have difficulty kneeling down in certain yoga poses or whatever it might be, this activity is a beauty. In all my time teaching self-treatment, I've never seen anybody teach it other than those I've taught it to. So what we're going to do, take the medium-sized ball, place it nice and high in behind the back of the knee. Close the knee joint down, interlock the fingers. Fingers go over where the ball is, so we're pretending to grasp the ball. We're not slopping the thigh around. The femur or the thigh stays still, and we're literally creating tibial rotation, or rotation of the shin bone on the femur. Relax your head back. Once you've done that for about 30 seconds to a minute, open the knee up, shift the ball down about half a ball width, follow down with the hands and create more compression. If you need more, pop the opposite foot up and over. And I don't want any knee pain with this at all. All the discomfort that you'll be feeling will be in the back of the calf and maybe a tad in the hamstrings. But fantastic to release through that central portion of the gastrocs. Really great for opening the knee up to get better knee flexion, and also really nice mechanism to help clear the hamstrings during that range of motion. All right, so spend a few minutes doing that one. Absolutely brilliant, and let me know how you go. Cheers.